Welcome to the Why on Earth Communities Stewardship and Sustainability podcast series. Today we have the opportunity to visit with Dr. Jandel Allen-Davis. Hi, Jandel.
Hi, Aaron.
It is so wonderful to have you with us today.
It's so cool to have this opportunity. Thanks.
Thank you. So, Dr. Jandel Allen-Davis is the president and CEO of Craig Hospital in Denver, Colorado, a world-renowned rehabilitation hospital that exclusively specializes in the neurorehabilitation and research of patients with spinal cord and traumatic brain injuries. Dr. Allen-Davis was the Vice President of Government External Relations and Research for Kaiser Permanente, Colorado, from 2009 to 2018. And in that role, she led the organization's government relations and regulatory affairs, community relations and community benefit investment, clinical research activities, stakeholder engagement, communications, and advertising and marketing functions.
A little busy.
And Dr. Allen-Davis is board certified in obstetrics and gynecology and was active in practice for 25 years. She's a graduate of Dartmouth College and Dartmouth Medical School, and completed her residency at Thomas Jefferson University Hospital in Philadelphia. Dr. Allen-Davis is also a very active participant in the community and currently serves on the boards of the Denver Botanic Gardens, the Denver Metro Chamber of Commerce, the National Jewish Health, Mile High United Way, and the Geisel School of Medicine at Dartmouth. Am I pronouncing that correctly?
It's Dr. Seuss, Theodore Geisel.
Theodore Geisel, right. She is married and has 2 children. And as I'm sure you can gather from this brief bio, Jandel is extremely busy. And with that especially in mind, thank you so much for joining us today for this conversation.
An honor and a privilege, so it's all good. It's all good.
Well, I'm so excited to dive in. We've been chatting a bit about the connections between the work that you're doing clinically with the patients and your role in the leadership position of this organization. And I think there are insights we will be gleaning that apply potentially to all of our lives and roles in the world. And I guess diving in, will you just tell us a bit about your role and what you're doing here?
Well, thanks, Aaron. I've been at Craig now. Tomorrow will be 5 months. So this is new work. And, you know, if it proves anything, it's that you just never know what doors are going to open. Because even, you know, sort of hear what I've done in my life. In 25 years, I actually practiced. I took care of women and families in terms of obstetrics and gynecology. To think that a door would open where you'd find yourself at some point, A, a CEO and president, B, of a rehab hospital, D, or C, as an OBGYN, it's like it doesn't make sense. And yet when I look through the rearview mirror, there is such logic to how I find myself here. And it does have to do with all the experiences that I've had, and in particular the clinical experiences, let alone the technical and even sort of the, I'd say, grooming in a sense that's gone on over these last 9 years, but who knew? It does make sense, but at the heart of it, for me, it makes sense because I have a firm belief that one of my roles on this earth is to be a warrior for the underdog, for the vulnerable.
Oh, I love that.
So, and I had to figure that out because I get and have had over the years, you know, emails or phone calls about roles that are opening up in other organizations. And I love Kaiser Permanente. I was there for 24 and a half years, and most of that time as a clinician in practice. So why this one appealed to me when I was called, and by the way, the first time I was called, I gave the recruiter names and hung up, and then was yelled at and encouraged by a friend that he wanted to talk to me. You go, me? And so then as I really got to understand a little bit more about this gem, which interestingly I knew was here, I knew they did rehab. I never thought about it any beyond that. I wasn't in that part of patient care, so I had no idea what they even rehabbed, as it were. But the more I learned, I said, yeah, let's have a conversation. And then when I knew that I needed to do this interview, I said, you got to be able to tell people why you want this. Slow down long enough. Why is this so attractive to you? Because it wasn't about money. It certainly wasn't about title or position. There was something else. And so that was when it hit me that it's because this patient population represents a level of vulnerability that needs a voice, needs someone to be their face in community. And through the recognition of that it's a social, the way that we treat people in wheelchairs and with brain injuries, we marginalize them. And I had to even sort of face that myself. It's not that I ever thought, oh, you're awful, or I don't like you, or that, but we cease to see them. We see them as less than, and we forget. And that's when it hit me. I said, these are people who woke up with one reality and are going to bed with a very different one. I mean, and all of us are one accident away. That's what we have to realize, is that we are all potentially could find ourselves at a Craig. And then you're not at Craig forever, and then you get to go home, and home to what? And is our communities welcoming, and are they safe, and are they accessible, and all the other sorts of things we need to think about. So it just got my social justice hackles and my sense of being a warrior for the vulnerable, coupled with the healing and the healer in me, who doesn't touch these patients, not from a, I'm not a clinician in this role, but the idea of being back with patients and sort of thinking about what I can bring after, through all those years where I was caring for folks to this work, it is so logical that I'm here. And as a leader, there's something about this particular culture at Craig Hospital, how we serve our patients, that I've told everybody, I have never been in a place that's more patient and family-centered in terms of care. How we care about and think about our patients in this holistic, integrative fashion. That totally gets me jazzed.
It's just amazing. As I shared with you previously, a dear friend of mine was here at Craig a few years ago, and he has recovered in such a beautiful way. And I remember visiting him just within a couple days after his accident here. And it was one of the most unusual experiences in my life to see him need to rebuild memory, rebuild story and identity. And I'm struck hearing you talk about your role in the position of leadership as the CEO of this institution that is, on the one hand, through so many clinicians and professionals providing this incredible service to all of these vulnerable individuals. And on the other hand, you're bringing along the board and other stakeholders in the institution. And I imagine that your capacity for storytelling and for relating to these different constituents is a huge part of your efficacy as a leader. And I was wondering if you might speak to that a bit, because I think our audience would really learn a lot about that.
Well, first of all, we know, and I can be a little scientific or something for a minute here, that if you want to watch people literally lean in, let alone figuratively lean in, link data and information to stories. There's something about storytelling, those I like to call them those campfire moments where, you're in a groove, you're in a rhythm, you're talking about things, and it's so much fun when, some flash of something comes and I say, oh, I have a story about that, or I remember once, blah, 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 and then bringing it back home. What excites me, and it's one of the many things that excites me, is thinking about the stories that I get to build over this next many, many years. I hope that I'm here at Craig that will serve our patients and serve the world in some way. It'll be kind of cool. But probably one of the coolest, I think, things that I decided some years ago, as I have been this ardent student of leadership, let alone had these amazing, the privilege and honor of leading in a lot of different ways. Years ago, it was 2014, I said, or actually before 2014, I said, I am going to one day write a book. And I want to write a book entitled Everything I Ever Learned About Leadership I Learned in the Care of Patients. And I figured it out because when leading my last team, the team I had as a vice president at KP, I found myself always using clinical examples as metaphor for what we were doing. I mean, one of my favorite questions to ask the team when trying to get a sense of what was the health and well-being of the teams that these folks led doing or going, I'd say, who's in your ICU? Who's in your ICU? And I sort of get this look, and I go, who is literally sick? Who has some toxin, in terms of either how they're showing up or being in the presence of the folks on a team in a way that they're spreading, negativity, and it is a toxin or a virus. Who's ill that way? Who is struggling with something that we need to, just like in an ICU, shepherd the resources to figure out what to do to help them either help them out, or help them out. And that's the reality in all institutions too, that, we help them out or help them out. And so that was one. And so, there were loads of those sorts of ways that I thought about things. In fact, one I told myself, tell you another great one is, when I first started that job 9.5 years ago, that was 2009, and you may remember in 2010, the Affordable Care Act passed, and even early in 9. But I had this crazy. You talk about a learning curve, it's like a baptism by fire for the government relations part of things.
Wow.
And I would have to tell myself, I remember saying, when the media called, for example, because I had media relations, and this was relatively new for me, even though we had somebody who was on the team who did media, she's going to bring it all to you, the help handler, he's going to bring it all to you. And I would have to ask myself, is there blood on the floor? Now, what do I mean by that? So I'm an obstetrician. There's blood. There's a lot of blood in obstetrics, and there can be, whether it's a C-section or a vaginal delivery, or even, unfortunately, sometime in gynecologic surgery. And what you learn to do over a career, as you get comfortable with what you're doing, is you learn to know when your pulse should quicken, and or to recognize when this is a high drama moment, this is an emergency, that kind of thing, and when you've got time or you can pace things differently. And by the way, the more that you do, the less you see that your pulse, that you have to react like, oh my God, because you learn and you know how to handle it.
Yeah.
Well, I had to tell, so my phrase when I got over to that side of the business and started doing no more clinical is, all of this stuff is new, and when it's new, it seems like there's blood on the floor everywhere, right? So I'd have to slow my roll and say, is there blood on the floor? And and then just do a quick assessment, and sometimes you use others to help you assess it, those who live the work longer. And then just say, chill, you got this. You got people who will help you out of it, and that's exactly how the good clinicians practice too, is they didn't look at it as, this is mine to solve. I play my role well, and I've got team members who, together, we're going to figure things out. And so you begin to so that's another example of this use of story.
Yeah.
And then you can say, oh yeah, I remember this one case, or that kind of thing. And then
you're not carrying all of the weight yourself as a solo operator.
And you're learning, and you know how to react. And the one thing that I think is so important, both as a physician and as a leader, is coupled with authenticity about when things are really icky. You got to be honest and transparent, and that was real important with patients. Don't lie, never lie, never sugarcoat. But this notion of authenticity and transparency in the face of some ickiness, but you never, ever, ever lose hope. So my role is to be calm under fire and to provide those signs in the environment that things are going well, because that's so part. There's this book, Strengths-Based Leadership, that was written by the guy, is it Rath, who did also wrote Strength Finders. And he wrote a follow-on to that called Strengths-Based Leadership, and it's one of the Gallup books. And that organization studies everything and surveys everything. And he talked about or described that has a chapter on the needs of followers. And he said what followers need is hope, compassion, stability, and trust. And we can always, always infuse that, even in the ickiest of times. And that's the case when I'm having to tell somebody that their baby's died. That's the case when I've got to tell somebody you're not going to make it here, in this particular role you're in. That's the case when you have to tell a patient your problems are of your own making. I'm here to help you. Let's work together on whatever it is. That's the case in management and leadership when you're dealing with a performance issue with someone.
Yeah.
I always want to be compassionate, and I want to be gentle. I want to make sure that they sense my sense of confidence that they can do it. That's the hope part.
Yep.
And that the ground's not shaking underneath you, even though nobody wakes up in the morning and goes to work and says, I hope somebody tells me I suck today.
Oh, gosh.
And no patient. Nobody wakes up in the morning saying, I think I want to be a patient. So,
right.
I think there are really some cool parallels between what I learned at the feet of my patients that informs how I show up as a leader. So,
yeah. You were mentioning to me earlier this afternoon that you see your role as a clinician interacting with patients often as similar to being a personal coach or a life coach. And it sounds like you do the very same thing with your colleagues and the folks working in the organization under your authority. And that's probably a skill we develop over time. And when it's well developed, it's a remarkably powerful skill, isn't it?
Yeah, you know what's funny? I had a colleague some years ago who, I'll never forget this line. We give to physicians, a whole lot of, sort of homage or sort of a sense of omniscience or that is not true. And in healthcare, we know a lot and we continue to learn more and more about, sort of whether it is biomes of all sorts or genomes or you name it, let alone in this space that I get to work in now, how this thing called the brain works. We're learning more and more, and we use such a tiny component, portion of it. All these things, like we've known forever, just drive more questions. And that has the power to humiliate, which is good. Keep us humble. Keep us very humble in terms of, you answer a question and 7 more pop up on that topic. And so one of the really cool things about what I get to do here as a doc, and it was the same there, is this notion of you know what you know, but you don't know what you don't know. And I don't know anything. I'm learning. I'm being a little silly, but I'm learning how the science of brain and spinal cord injury, in part because I'm curious and interested. But what I get to do when I walk the halls, our patients stay here for, months, weeks for sure, and months in some cases. So I get to see them along their journey. Some from the moment they arrive, if I'm asked to make sure I check in on somebody. But others I've just gotten more and more comfortable at just walking up to folks in the hall and saying hello, because they're going to be here. We're gonna bond.
Yeah,
so
you're
I get
living
friends.
together for a while.
Yeah, I get friends around here, I call them. And I get to see their progress because I don't see them every day. And I think one of the coolest contributions I can make, I like to think, to their recovery, or that notion of hope, compassion, stability, and trust, is when I see them, I get to see the miracles. I get to see the miracles, I get to watch the recovery, but I'm not, the one who's seeing it incrementally day after day. And to be able to say, oh my God, look what you can do.
Wow. Beautiful.
This is amazing, because they can't see it. It just, you
so
can't see it. And when I was in clinical practice, telling a patient, who I might have been rounding on in the hospital every day, you're doing better. It's not the same as a week goes by, or when I see him back in the office at 6 weeks for a check, it's like, wow, look how much better you're doing. So I get to do that here. The same goes for how I think we need to think about coaching and growing our teams is when we see changes in terms of how they're really leaning into trying to get better at what they do. Point it out and tell them the stories and give them the examples of, I saw you doing X, Y, Z. That was awesome. That kind of thing. So again, it's that, I think one of our most important roles as a leader, I like to say, is these need to be 3 times as big as this, even though right now it's not in this particular.
Well, it's a podcast.
Okay,
This is okay.
yeah, it'd be a mess if I was quiet. It kind of wouldn't work.
It wouldn't work.
It wouldn't work. But so it's to use all those other senses, which we also do in medicine, by the way. Use all those other senses to help read the environment. And so it's kind of a cool thing to get to walk around these halls and watch patients get better and know that through that lens of hope, compassion, stability, and trust, how are you helping them to see what they can't see? And the same goes to the folks that you get to work alongside.
It's beautiful. What I'm hearing is sometimes this perspective that you can bring in your position that is less frequent than some of the other interactions and interactors brings a special potency to it. And it makes me think of that phrase, less is more. And occasionally when I'm working with executive teams and folks that I'm helping in the realm of leadership and sustainability, I will tell them, you don't want me with you every day of the week. I will actually be less effective for you that way.
Yeah.
And not that that's necessarily true for each and every one of us in each and every positions we can play in the world, but it does seem in certain positions that occasional touch point becomes almost homeopathic in nature. It becomes such a strong opportunity for reflection, for change, for feedback, and so forth. And what I'm hearing is you do this routinely in your work.
You know, that's why I'm about to say something that sounds anything but humble. I think it's it's just who I am. And I know you didn't ask, well, how? I do it routinely in work, but it's as natural as breathing if you just let it be. You know, if you don't feel like you, as a leader, need to walk around buttoned up, or you have some sort of sense of the archetype, some archetype of what a leader is. It's anything other than just, a leader is someone who, first of all, they are servants.
Yeah.
We sit at the feet of the people. We don't lead people, we serve those people. And some of that serving, a big dose of that is coaching and mentoring and guidance. And then there's inspiration and vision setting and all the other things we have to think about. But your comment, gosh, it just made me think of something. It'll come back. But yeah, we don't see them. It'll come back. I totally lost it. That's okay.
Well, let me, that's actually a really funny segue for me to ask you another question I'm just burning to ask. So you're working here in a setting where folks are dealing with injuries and issues related to the brain and to neurology. I've heard it said, and I don't know if this is still considered true, but I've heard it said that we understand more about outer space than we do about the brain and our own neurological systems. What's going on with our neurology? What is all this that allows us to interact the way we do, communicate, learn, etc.?
Oh, he thinks I have the answer to that. I'm going to write it's a textbook. It's right sitting right over there. I'll just make sure I share it with people. Who knows? I think, when I think about that part of sort of life, I have this, like my husband says, I have a memory like an elephant. And I can remember things from childhood. I remember songs. I remember things from tiny. I can remember smells and being places and sort of a sense of even lighting of things as a little kid and even as I got older. And I find myself sometimes thinking if a song comes on the radio and I just go la 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 and I go, gosh, where is that stored? How is that stored? Let alone, I think we get the why. Or we've made up a why as humans. The why is because there's this iterative sort of forward nature, and everything that we've learned prepares us for whatever is next. So maybe it makes sense or has some applicability. A lot of it doesn't. But I say, is it ones and zeros? That's what a computer would say. It's ones and zeros. I don't know, but there is something magical about the brain. And the part of it that actually interests me more than the cerebral cortex is the mid part of the brain, the more primitive parts of the brain. You know, the hippocampus and some of those places where we store our unconscious and our subconscious sort of sense of things, the part that gets us to work every morning without killing anybody while we're talking on the phone. We shouldn't be.
And drinking coffee.
Or you know how it is when you find yourself at work and say, I have no idea how I got here.
Yep.
And so there is this other, I think we need to pay way more attention to that, not only understanding neurologically what it is, but tapping into that to understand our motivations and what we're, you know, that notion of real self-knowledge, because it's back there. It's not in these, you know, these big old cortices here, which we have the ability to learn, but it's the primitive parts that, and actually even the transfer of what we learn from here that becomes subconscious, so that driving is as natural as whatever, or these elite athletes can do what they do without even thinking about it. There is the thing that excites me, and I know I won't be around to learn it all, because I think, as I said, you answer one question and 7 more pop up. It is going to be exciting what we learn about the brain. I've heard stories, and one, and I can't remember who in the hospital told it to me, but a patient who, after a severe brain injury, could suddenly do amazing art, and they didn't do art before.
Yeah, yeah.
So, you know, we recruit and we use the accommodating way that the brain sort of picks up where the other part, or comes in when another part goes out. It is pretty remarkable to hear our music, or our speech therapists, and we have music therapy here where we're using music to help people learn how to count, right? Or to pace themselves when they're walking, or to speak again, because that whole notion of music comes from, I guess, a different part of the brain than necessarily, you know, the way that we express or even hear information around the parts of the brain, Wernicke's and Broca's area. I remember that from med school. And expressive and receptive aphases, where if you hurt that part of your brain, you either don't understand what people are saying or you can't express it in a way that you can hear it. So, I mean, it's just one complicated organ, and I find myself thinking, then and complex, how does it recover? This is all the cool stuff that, you know, we're going to figure stuff out, and the pace at which we're figuring stuff out in science, just in general, is
remarkable right now.
It's accelerating so much.
Yeah.
We may actually figure out a whole lot before I leave this earth.
Right.
So it's kind of cool.
I hope so.
I do.
You know, there's a thread here. We're talking about an incredibly complex and adaptable organ, if we can call it that. We're also, this is our Stewardship and Sustainability podcast series, where we explore linkages between health and well-being at the individual, the family, the community scale, and how that links up to global scale issues of sustainability, regeneration, stewardship, etc. And I'm really curious about the insights you might have around behavior change and around adaptability and our ability to wake up one day, sometimes because we have to, not that we want to, and suddenly we've got a very different situation and we can learn to respond to that. I'm curious if we might take some cues and more proactively choose behavior change as well, vis-a-vis some of these broad and complex issues we face as a society. But I'm just curious on this topic of adaptability and behavior change, if anything comes to mind for you.
You know, it's one of the words that I was saying before we got started, that we had this amazing conversation as a group of 20 or so, actually more than that, I guess 24, 25 leaders today, on what makes Craig so special. They talk about this thing called the Craig culture, and back in 2004, the then CEO, actually the first CEO of this remarkable place, of the modern Craig, because Craig's been around since 1907, but penned, along with a number of other folks in the organization, this thing called the Craig recipe. And it's like, what makes this place so darn special, and what makes it hum? And I happened to find it in a drawer right after I started here, and I just got this huge smile. I said, my gosh, I'd been here maybe 2 or 3 weeks by then, and I read this and said, gosh, a place still functions like this. And I don't even know that many people even, there's enough turnover in workforces, even though we certainly have some people with long tenures, that there's a lot of people who've never even seen this. And yet I can tell you that this thing is hardwired as can be. And so when we had this great discussion today about why does it endure, what do we need to think about adding in terms of, in light of changing external environment and even internal environment, and are these still the right, is this still the right recipe and so forth. And listening to this incredibly committed group of people leaders talk about this topic, first of all, it was cool to watch that happen and think, this doesn't happen in most organizations where we make the time to have a discussion like this as leaders and think about what's our accountability and responsibility to lead and to serve. But I went to this place of thinking about organizations as trees.
Yeah.
I love trees.
Yeah.
But trees, and really that notion of the metaphor of the roots. I mean, what is the substrate that makes this possible, that makes this sustainable? And of course, then you get this sort of heavy feeling, and don't screw it up, Allen-Davis. Don't let it go. But I threw into the room a few things. It strikes me that it's things like resilience and adaptability and joy and determination and hope. And then someone else said, this notion of we come to work here out of a real sense of oh God, it went out of my head, that the notion of generosity. It'll come in a minute.
Yeah.
But that you really want to help these folks in a way that, as I said, and then what hit me was, as I said, this is the most vulnerable time. These folks are, like, there's nobody more vulnerable than someone who is in one of these horrific, catastrophic accidents, who often can't feed themselves when they first, can't go to the bathroom, all these things that we take so for granted. And our job is to help restore that, obviously rehab, get people back using adaptability and resilience, but also hope, and it's celebrating the small victories through a lens of joy. And I see determination like I've never seen. I mean, there's something about these accidents when they happen to people that many say they didn't wake up wanting it to happen, but they'd never want to go back to the way they were before because of what they have tapped into in terms of their, parts of them, back to whether it's literally their brain or their neurologic system in terms of, the compensatory things that can happen in this space. But it's more that what they discover about themselves that they didn't know. Or because this is a place that has has access to and provides sort of this holistic team-based approach to care, there are things that insurance doesn't pay for, but that we have these amazing donors who allow for, like therapeutic recreation, where people, but they have these outings, and one of the weekend's outings 2 ago was to go do archery.
Cool.
Well,
cool.
I'd like to do that,
Yeah,
I think.
seriously.
And then people discover that they can do things they didn't know, that they either had the capacity for, or even in their former life would have never had the opportunity to be exposed to these things. So there's this, I told them at the end of my kind of thinking out loud thing, I said, we live in a place with, sort of this sort of sense of the contradiction in terms of what you think you should feel and see and hear here and what we actually do. It's there. It just blows me away that we do it, and because we do it, I think it changes us. And I am convinced, this sounds corny as can be, but it's not true. I think we are better because we get to serve these patients and these families the way that we get to do so. And do we in turn then take that out to the world, and what's that look like in terms of our own relationships with others who we get to hang with, our families, our friends? We are changed by this just as much as our patients are.
It's so beautiful. It's palpable walking
You can
in
feel
here.
it, can't you?
Yeah, and you would expect a facility like this to perhaps have a vibe of Debbie Downer or something like that, right? But it's not at all.
Wow.
So folks are so friendly, even down in the lobby. I was struck. It was like encountering a handful of new friends.
You know, it's I've told back to now a clinical reality that translates beautifully into leadership. And these folks just reinforce this belief for me that I've had for a long time. And I used to say it to, and I do still say it to leaders and folks, is that our people want to see and be seen by us.
Yeah.
They want to be seen by and be seen by us. And you end up in a chair, or you end up not being able to quite get the words out right, or you end up severely disabled. And what people want more than anything else, and this is what the nuns taught me in Catholic school, is that all life has dignity, all work has dignity, and you want to still be treated in that same way. You want to be received in that same way. You don't want to be seen as lesser. So I was real uncomfortable at first when I came over, just walking up to people in chairs or our patients and saying hi, in part because I felt like I was invading their privacy. And they want nothing more than to say hi. First of all, everybody wants to talk about how great it is here. I get that. But they want to know that you see, and then I'll say I'm the president and CEO, or I'm the president of the hospital. They go, oh, I get to talk to the president. It's not a big deal. You know, I put them on the same way you do. Or, you know,
all on the same level.
All, we're, you know, this is, so, yeah, it's, people want to see and be seen by us. And the sense and our ability to open up our hearts and sort of really be as vulnerable as our patients are, you know, to experience that and to live that, occupy that space in the same way that they do, obviously without the physical barriers, but more just, if you think about when that happens, what's that patient feeling? Fear, hopelessness, shock, worry, concern. There are things on that desk over there that can bring out the very same emotions in me.
Right.
And what I'm looking for then is somebody to see me or to help me. And we get to do that here. And I think that's what the world is longing for, is leaders who will show up that way. Because then they'll help you. People are willing to go to the wall for you if you are willing to ask and to show your humanity and your humanness.
Yeah, beautiful. Well, speaking of cultivating our leadership abilities, capacities, I'll take the opportunity to make a couple quick public service announcements. This is the Why on Earth Community's Stewardship and Sustainability podcast series, and we're visiting today with Dr. Jandel Allen-Davis at Craig Hospital in Denver, Colorado. And we've got some really exciting things to share with you. In May 17th to 19th, the Why on Earth community is hosting a 3-day leadership summit, and it's called Massively Mobilizing Sustainability, Deep Leadership for the 21st Century. And we're bringing together a small group of amazing leaders, authors, community activists to have a rich cross-disciplinary discussion and learning together for capacity enhancement for educators, executives, and entrepreneurs. And although it's not totally official yet, it sounds like Jandel may be joining us as well, which is going to be fabulous. I want to also mention that this podcast is made possible in part through the generosity and collaboration with our sponsors, the International Society of Sustainability Professionals, the Association of Waldorf Schools of North America, Waylay Waters, Earth Coast Productions, and Purium. And you can use the code YONEARTH at any of those websites to get discounts on the products and services that are available. And also, finally, for any of you who might be interested in our audiobook or ebook resources at the Why on Earth community market, you can use the code YONEARTH for discounts on those as well, and that's the letter yonearth.org. I am so excited about the programming that we're going to be able to share with folks in May. and through this podcast, Jandel. And one of the things that strikes me as we're talking through all of this, there's so much going on in the, if we can call it, the microcosm of Craig Hospital and the folks that you're serving here that can really broadly apply to so many big system and big picture issues and challenges we're facing as a society. And I remember speaking with you about this little four-letter acronym. And I remember a friend joking recently about TLAs and having an aversion to TLAs, and I'm looking at like, what's a TLA? Three-letter acronym.
Oh, three-letter.
And I just couldn't help but crack up. So I guess this is an FLA,
This is an FLA.
Four-letter acronym. And it's VUCA, and I think you first shared this with me a couple years ago when we were chatting. And it's such a brilliant framework for understanding some of the stressors really that we're experiencing in life at every scale. And then there's sort of a next step or a companion acronym to go with VUCA as well. And I was hoping you'd talk about that a bit.
Chat a tiny bit about that. Well, VUCA stands for Volatility, Uncertainty, Complexity, and Ambiguity. And you'd hear those words and think, what sort of Naropa-like place came up with VUCA?
Right.
Well, it turns out it's actually the military.
The military,
How's that for Naropa?
A little different.
I hope that doesn't get me in trouble.
A little different.
But and it actually was a phrase that was coined in the military in the post-Cold War era.
Yeah.
Where, I mean, if you think that we started fighting and conflicts started looking different across the globe after the Cold War thing, and only heightened after 9/11, where you really don't know where. And I mean, it's why we've seen so many more brain injuries. Not only is it's not just about the technology or the instruments of destruction. It's that wars are fought and conflicts look different, and who's engaged in it. So. The late 90s, they finally took this, sort of started writing and really coined this VUCA phrase in the military. And then after 9/11, business picked up on it. It sort of started getting out. And I happened upon it quite by accident one day a few years ago on the internet. And there is an antidote to VUCA. It's vision, understanding, clarity, and agility. And, I'm reminded of another story. I do love telling stories.
Fabulous.
There was, and this is a story that maybe others know, and it's about sense making. Because if you think about vision, understanding, clarity, and agility in the face of volatility, uncertainty, complexity, and ambiguity, what we have the opportunity to do, and I dare say as crazy as things can feel at any given point, we have the obligation and responsibility to do is to sense make. And so the story is, and I'm going to tell it wrong, but I'm going to do it anyway. It goes back to World War I or II. Anyway, back to one of the wars, and one of the leaders sent a group of, I don't even know all the military things, a platoon, a band, which is not even close to right, but a group of soldiers out on some sort of a mission. And this was over in the Swiss Alps, I believe. So they're there and they do their thing, and this snowstorm comes in and they get terribly lost. And they get really freaked out. They don't know, they've lost contact with them back at the base. The leader is feeling terrible about, feeling horribly guilty about this happening. Well, they do end up, the leader of this group, platoon, I don't know what you call it. Anyway, we'll call that. Finds a map in the bottom of his rucksack, and they use this map and they navigate themselves back and out. And they're in the hospital and they look at this map, and it wasn't even a map of the Swiss Alps, it was a map of the Pyrenees. Wow. And so the sort of moral of the story is, when you're lost in a snowstorm, any map will do. When you're lost in the forest, any map will do. When you're lost in your life, any map will do. When you're lost and not quite sure how to do what, challenge is facing you, any map will do. And what that maps, you can think of all the ways in what did that give to them, since it wasn't maybe all mountains are the same is what it means. But I kind of doubt it. There is the up and the down part, but beyond that, who knows? But what what that gave them was a true north for the moment, pardon the pun. Some way of saying, okay, it gave them this sense of hope and confidence. Okay, look, we found one. Let's just follow this. VUCA Prime attempts to do the same thing. In that moment where you want to poop your pants,
Yep.
you are that afraid. And we all know sometimes we can look cool as cucumbers on the surface and be scared spitless. It can be a new opportunity like this one where you go, holy cow, I don't know what a CEO and a president does. I think they made a mistake. So, which was my January 1st crazy meltdown.
Wow. Yeah.
Where you just sort of have this moment where you go, they made a mistake. Oh my God, I can't do this job. And then what you have to do, and I had to do it with myself even in that case, was just take a pill. What do you know? What do you don't know? I didn't literally take a pill. Actually, I waited till 3 o'clock, and I knew that somewhere in the world it was 5 o'clock. And I had a glass of wine, and then I could think clearly.
Another aspect of the microbiome we can be grateful for.
Amen.
Right?
Microbiome, absolutely.
Of wine, grapes to wine.
That's right, those sugars. But what that story tells me is that in those moments where, and you've got to have the intuition to know when people are at that space, and I think we are societally at that place for sure right now. We do have the option to choose, and that's where these cerebral cortices do help, because we can choose our reaction to things. And this notion of sense making, providing the map, telling yourself what you know and what you don't know, seeking as much clarity as you can about a thing, recognizing that when things actually are uncertain, complex, and ambiguous, you're not going to see a whole lot of clarity, but there's a few things out there that tells you that the world is. And just chart a course and take that course. It gets back to is there blood on the floor? Right. Ask yourself, is there really blood on the floor? When there is, you have to figure out what is the response. And I think given some of the crazy that we're all living in right now, this isn't where you answer the question, no, there's no blood on the floor. There's blood on the floor. We then have to decide, how do we want to engage and react to that bloody floor? Yeah. Is it ranting and raving on a Facebook post? Is it, burning signs? Is it doing whatever the heck is it? Or is it thinking about, in my small ecosystem, my small community, whatever that may be, what are the things that we can say and point to that things are actually, there's far more goodness going on than there is negativity. And where there is negativity, how do you effectively use your voice to combat that? And what's not destructive, what's not helpful? And by the way, secure your own oxygen mask first. I decided 3 days ago I am not listening to news for a while. Just can't do it anymore. There was the end of last week, and it was this whole thing that's with this Smollett, this artist, the actor who did what he did, where I realized, and then there was the coach from the New England Patriots. That's when I said, I can't do this anymore. I said, I had this moment where I realized, this is like wallowing in, like sort of taking in dirt every day or something. What is this doing to us on a cellular level? And that's, in that moment, you have a choice. I said, it's not like I'm going to become some big ignoramus. It's not like I'm going to ignore what's going on, but I can choose what and when and how to take this in. And I also can choose how to react to it. And so I think this notion of VUCA, that was a long way of telling the VUCA story, of vision, understanding, clarity, and agility, it requires slowing down. It requires turning some stuff off, as I just said. It requires throwing the agendas away at meetings like we did today and just rapping, having a rap session. How's that just for showing my age? And allowing people to put their voice in the room in a way that's different, because you know that it's out of that there's a sense of, I can feel earth. The earth is solid. We can see our way through this. And by the way, while the world may be changing around us in healthcare, we've got all the right stuff to know how to weather this storm. We got the map. And we can make the map. We can make the map. We don't have to wait for somebody, Don't sit by the side of the road and await rescue. Ain't nobody coming. We can do this. We can
Yeah.
do this. So, yeah.
Well, it's so interesting. I know we need to wrap up in just a couple minutes, and there's one final thread. I know I would feel remiss if I didn't ask this. When I hear you talking about the observational capacity, is there blood on the floor? When I hear you talking about the sort of self-regulating awareness that says it's time to turn off the radio, it's time to turn off the news. When I hear you talking about being in a leadership meeting with 24 of your senior team saying we need to throw the agenda out for a moment and do this other thing, what I'm hearing, what I'm experiencing actually, it's kind of cool to feel, is that there's a de-stressing, there's a lowering of maybe even the stress hormones that would otherwise respond to these things in a different way. And I'm just curious if one of the keys in all of this that we're discussing in our own lives and how we're serving others and our roles as leaders and in our responses to some of the big challenges that we're seeing in the world, if we each become a bit more perhaps intelligent, I don't know if there's a better word, about managing that neurobiochemical response system that we've got, that might be one of the kind of keys or parts of the map or something.
It absolutely is, and you know, so you can start from that space of talking about we have the opportunity to choose our reactions. It does start, though, with having a deeper sense of where you are, both physiologically, emotionally, mentally, spiritually, physically, in any given instance. It's sort of like there's another old book that was written. It's actually sort of a true story. It's called The House of God, and it was written in the late 70s, and it's about an intern going through his internship at the Beth Israel in Boston. And he has these rules. They're these House of God rules. And one of the House of God rules is in an emergency, in a code where somebody's heart is stopped, during a code, first take your own pulse.
Wow.
So that's why, it's an amazing book. There are those who think it's kind of cynical, but that one, in an emergency, take your own pulse. So there's this moment where you need to stop, and you do need to sort of assess where you are. Because I think what happens over time, and I've unfortunately lived in an environment like this. Kids live in environments like this, and some of the sort of the chronic toxic stress that that's been so well described in kids. That toxic stress exists in our workplaces. It exists in our homes, our families. And it certainly exists in our community. And I think this really weird thing in terms of how this, back to this thing, is wired, happens. We can pretty quickly get addicted to the drama.
Yeah.
And I think we've lived that for sure. At least I will own it. I have over these 2 years. It got to the point where I'd get in the car at night and go, let me see what happened today. And it's as much to sort of, it's feeding something that must be on some level pleasurable that we're not even aware of.
Yeah.
But mostly it is as destructive and toxic as taking a little arsenic every day or finding yourself addicted to opiates over time.
Yeah.
In terms of the lull, the pull of wanting to see what the crazy leaders have done this week or today, because there is this point, and sort of so there's this self-awareness part that you got to do. Take your own pulse, and recognize the power, because this is addiction. It's just a different kind of it. It's not as obvious an addiction, but we are living in a place, we are living in a space where we are addicted to the drama, where there's some voyeurism that's playing out here that's not healthy for any of us. So I think that that's the first part of sort of figuring out, is there blood on the floor, is being able to just sort of check into how you're feeling and looking at things because I actually think there's some data that shows that the amount of alcohol intake that has really increased in our society over the last couple, 3 years. So are you finding yourselves responding and reacting to stress in some ways in terms of sort of then after if there's a cycle, I want to know what's going on, listen to all that, and then, in terms of what it literally physically does to you. I'm not talking about the emotional, physically. And then what do you do to self-medicate? What's all that self-medication look like? and is it healthy or not? And then how do you pull back from it, I think is the big question that we have to ask ourselves, and how we manage that. And again, look around the environment then, around what is certain. I remember working with my team, one of my teams, at a time that was super, super stressful. And I said, one of the best things we can do, and I remember grabbing the table and saying, is find that solid earth. When it is, this VUCA thing, find the solid. You know, look around, that's still here. What has not changed in our environment that helps me know that I'm still where I was before I lost my mind and let the crazy in? And then we would do that exercise with ourselves. Well, we still have a healthy team. We're still checking in. We're still figuring out who's in our ICU. We're still being creative. We're still. Just as a moment to say, okay, now we can manage that. That's when agility comes in. That's when we get at least enough of a pause from the crazy to figure out what's our map forward. How are we going to wade through this? And maybe we won't be able to wade through it in terms of being able to affect or impact the big picture, but the little picture rocks too. And if we could get more people to do that, you know, we can turn this puppy around. Absolutely. I mean, when you think about even sustainability in the sort of more literal sense, you know, I find myself thinking, why am I composting? And I do. It's like, I love it, by the way. I think it's a cool thing to do. But we need way more than me and you composting given this earth. Why do I recycle when we know there are people who don't? There are businesses, organizations that don't. Well, it's because I'm controlling what I can control. And through that, and even mentioning to people, I got 3 compost bins out back. I'm probably not the best composter, but I use the stuff in my gardens. But I mean, in terms of, I don't go out and turn it the way I'm supposed to and all that stuff, but it works.
There are lots of critters in there, I'm sure, doing a fabulous job.
It's fine, because I'll go out in the spring and go, ooh, look at that. You know, that's a whole nother lesson. Don't overcomplicate it. It's not that complicated. A lot of this stuff we overcomplicate. So we have to do our part, and then talk about our part to see how do we make the little ripples out by influencing the environment in which we're in, as opposed to worrying about the stuff that that at a systems level, that wouldn't it be nice if I had a magic wand? Wouldn't it be nice if any of us had a magic wand? If someone has one, for God's sake, somebody wave the damn thing so we can get some crazy out of things, but we don't. So you do these incremental things. It reminds me of that parable of the starfish or something. Do you know that one? The little boy on the beach, and I guess this happens, that he came upon, there were like thousands of starfish that had washed up on the beach, and he's picking one up and throwing it back in, pick one, and somebody comes by and says, why are you bothering? You can't save all these. You can't make a difference. Look at this. And this kid says, I saved this one.
Right.
And that's the way I think we need to look at this, which requires, I think, a wholesome presence, both in terms of being able to check in on yourself, a wholesome presence, and being able to check in on your buddies, whoever they may be, including family and friends in your workplace, and knowing when you just need to turn off and take care of you.
Absolutely.
Yeah.
So beautiful.
It was fun.
Well, maybe we all together get to wave that wand over time, and that's
what we
part
need.
Of what's happening.
That's the movement that we've got, and I am concerned that what we as humans tend to do is think that when something's kind of wacky, we need to make big changes. I can tell you another quick clinical. I know we're talking too long, but I was a medical student doing a pediatric ICU rotation at Children's Hospital National Medical Center in D.C. So I came down from New Hampshire and did this sub-internship as a fourth-year med student. And that was back in 1983, when they let us do a lot more as medical students than you'd ever get to do today. And that's a good thing, by the way. And in some ways maybe not so good, but it's overall a good thing from a patient safety perspective. So I had this kid in the ICU who was this ex-preemie, who was he 2.5 or 3? He was probably about 2, and he weighed 17 pounds. He was so, what we'd use, failure to thrive, and it was all because of the pulmonary complications from being premature, and we didn't have what we have today to treat it back then. And And this kid was my kid, and there was this one night that I was working in the ICU along with the critical care fellow, and we had 2 babies not doing well in the ICU. So I literally, me and the nurse and I had to take care of this kid all night. And we were having trouble, this is way clinical, but we were having trouble stabilizing his pulmonary artery pressures. And there was a drug, which I don't even remember the name of now, that we used to sort of bring those pressures down when we saw him getting high. And we were fighting this all night, and I'd go over and talk to the fellow who was working with another critically ill kid and tell him what's going on, and he'd be trying to make adjustments. This nurse and I bonded in a way that I will never forget, because there was something spiritual about the 2 of us sort of locked in mortal combat with something, the Grim Reaper or whatever, over this baby. And it was almost shift change. We're exhausted, so I'd been up the whole day before and the whole night, and we still hadn't really gotten this kid's pressure stabilized. This is another one I use with teams or talk to folks about. And then it's time to sort of get the bed and get the kid clean, you know, sort of set for the day nurses who come in, who's going to have him at 7 o'clock. And so the nurse is doing what she does, and she took this kiddo's head as she's sort of rearranging things and just changed the head ever so. And we watched the pressures normalize and stay normal. Here we were all night pushing God knows how many, you know, sort of cc's of the meds, nothing that would hurt the kid, and not able to kind of figure out what the heck was going on, and simply turning the head did something, and that it wasn't magic. There was probably something, and he was intubated. He was, you know, he was on a ventilator because that's what had happened. He'd had a respiratory arrest at home, and we just couldn't get him off the vent, but or didn't during the 4 weeks I was there, because when I left he was still there. But to think it was something that simple, and I always remembered that, is that often we try so hard, and it's often, we don't need like huge swings, which we're seeing. I mean, the backlash in this country to what's happening regarding racism, or you name the isms that we're seeing, is, I'm not sure that the response to that from, I'll say it, the left is any healthier than what we've seen and have been living. You often don't need to go that far. So I'd say, just turn the baby's head. And I tell myself that I will always remember that story. She just turned, and it wasn't even a big turn. She just kind of reorged and get the sheets and get them all cleaned up before the day nurse came in, and she just turned the baby's head. And his pressure stabilized, and I was able to leave that way. And we just both, I remember we looked at each other like, oh my God, it's simple.
Right.
Not heroic, nothing heroic or sexy. Turn the baby's head. So.
I love it. Well, maybe we'll coin a phrase, just turn the baby's head. And
that's right.
It can become viral.
When there's blood on the floor, turn the baby's head.
Love it.
So.
Well, thank you, Jandel, so much for being with us.
This was a pleasure. Thank you.
Such a joy to be able to speak with you. And on behalf of all of our audience, thanks for taking so much time out of your day. Really appreciate it.
And this is, as I say, when we get to do these things, we actually get more from them than we get. So this was cool. And I'll see you in May.
Sounds great.
Yay. I'll see you in May. Thank you.